Hello everybody, my name is Sumia Hassan and I completed my fieldwork at the Public Health Agency of Canada it's also called FAC, so I'll probably be just using that as a shortened name for it throughout this 3-minute video. So I'm going to be talking about my special project. So in 2011, the World Health Organization adopted the Rio Political Declaration, which expresses a global political commitment for the implementation of a social determinant of health approach to reduce health inequalities. So in 2012, Canada, along with other World Health Organization members, decided to endorse this declaration. And what Canada did was they began an initiative called the Health Inequality Reporting Initiative. So what that initiative is, basically they collected data from across the country, national and wide, and they had sort of like 70 indicators of health status and determinants of health. And what they did with those 70 health indicators is they segregated it into 14 different indicators. So if you actually go to health inequality, if you're writing Google Health Inequality Reporting Initiative on data tool, you should see this amazing data tool. So what basically is, it has, like, for example, the demographics on which indicator you want and then which stratifier you want, and it actually shows you a data tool, like a graph, and you could actually compare that. So my part was to create, my project was to create a cool map. So within FAC, we work as regions. So my region included both Saskatchewan and Manitoba. So what I have done is I created something cool map. So the data that was nationally collected, I got the Saskatchewan, Manitoba parts of it, and I entered it into a Excel spreadsheet, which will the picture will be shown soon, and then I analyzed the data gaps. So my description of my task was actually to analyze available data from Manitoba, Saskatchewan, and identify gaps, and then create a report and present on it. So I created a report. So the data entry took me almost 3 months, and I had to analyze it for another almost 2 weeks, and then I actually presented on it with both Manitoba and Saskatchewan. It was a really interesting project, and I'm really glad that I have done it. It took me a long time, but it was useful, and then they can actually use this to identify data gaps that we have here and initially, and maybe even create programs to kind of address these gaps. So thank you so much for listening, and that's my 3 minutes.